Hello, today I'll be presenting on my data analysis using the CMS Synthetic Claims Database for the Database Design and Management course. The following presentation will be a collection of 10 queries where I will showcase the format used in MySQL, a brief explanation of the data output interpretation, and the initial question that inspired the query. In this slide, I will present a query that calculates the total payment amount for beneficiaries who have both inpatient and outpatient claims. Since the purpose of this query is to find the total payment amount across inpatient and outpatient claims, I utilize the join operation to combine the data from each table using a shared field, which is known as the beneficiary's unique ID. And then to get the total amount, I just summed the payment amounts for both inpatient and outpatient claims for each beneficiary to get the total, which is the output here. This next query identifies the most expensive inpatient diagnoses based on the total claim payment amount. So the query starts off by selecting the diagnosis code from the inpatient claims table, which represents the medical conditions or diagnoses that led to the inpatient admission. And then I utilized the sum function to calculate the total payment amount for each diagnosis code, which would give the overall cost associated with treating this diagnosis. And then by grouping the information by diagnosis code, we were able to calculate the sum of costs for each individual diagnosis. This next query identifies how many beneficiaries with diabetes have prescriptions for diabetes medications. Beneficiaries are first identified as indicated in the database as SP_diabetes equals 1 in the beneficiary table, and the subquery retrieves the beneficiary IDs for those with diabetes that meet this criteria. The main query uses the prescription drug claims and the beneficiary ID to count how many of these beneficiaries have prescriptions listed in the drug claims table. We use the count distinct function to ensure that each beneficiary was only counted once, even if they have multiple prescriptions. This query identifies the most commonly prescribed medications based on both the number of prescriptions and the total cost. In the query itself, the PROD service ID column represents the drug category, which will represent the type of medication being prescribed. The count function in this instance was used to count how many prescriptions fall under each drug category, giving us the total number of prescriptions for each particular category. The sum feature then totaled the total cost of all prescriptions within each category, which helped identify which drug categories were the most expensive. The data was then grouped by drug category. This query presents the calculated average number of days spent in inpatient care for beneficiaries diagnosed with heart failure and how this varies across different states. The state code column from the beneficiary table was used to represent the state code for the beneficiary, which we can group in the results by the state where each beneficiary resides. The claim utilization column from the inpatient claims table represents the number of inpatient care days for each claim. The average function was used to calculate the average number of inpatient care days for beneficiaries that specifically had heart failure. The query then grouped the data by state so that we can look at the average inpatient days for each state individually. This query similarly looks at beneficiaries diagnosed with heart failure, but in terms of the total out-of-pocket cost for inpatient claims. The components of this query include the beneficiary's inpatient deductible amount, as well as the coinsurance liability amount for the beneficiary for inpatient care. The query sums both these amounts of the deductible and the coinsurance amounts to calculate the total out-of-pocket cost or the beneficiary responsibility for heart failure beneficiaries. The join clause connected the inpatient claims table with the beneficiary summary table using the beneficiary ID, and data was filtered for those only with chronic heart failure. This query identifies the 5 most expensive inpatient diagnoses for beneficiaries in the year 2010. The first component considered was the admitting diagnosis code, which is the primary diagnosis for the inpatient claim. And then the sum calculates the total payment amount for each diagnosis code, which gives an estimate of how much each condition cost for inpatient care. The data was looking only within the year of 2010 and was grouped by diagnosis code, which is necessary to calculate the total payment for each distinct condition. The order in which the data is presented shows the highest costs that appear first. This next query presents the calculated percentage of beneficiaries who show signs of non-adherence to prescribed medications. The number of days supply for prescribed medication is understood here as prescription drug claims times days supply. If a beneficiary has a prescription with less than a 30-day supply, this shows an indicator of non-adherence, assuming that the patient needs a refill before completing the full prescribed amount. By counting the number of beneficiaries who show signs of non-adherence, we can calculate the percentage of non-adherence overall for medications prescribed. This next query compares the total outpatient spending for beneficiaries with chronic kidney disease compared to those with diabetes. By filtering the fields from the beneficiary summary that indicate whether a beneficiary has chronic kidney disease or diabetes, we can then calculate the total outpatient payment amount for beneficiaries with either condition. From there, we can group the data by whether the beneficiaries have chronic kidney disease or diabetes, and this allows us to calculate the total outpatient spending for each group separately. My last query represents a calculation of the total cost of both outpatient and inpatient services for beneficiaries diagnosed with depression. The inpatient claims and outpatient claims were the first aspects to consider and refer to the payment amounts for both services. And then the sum feature was used to add the total cost of both inpatient and outpatient services for beneficiaries with depression. And the join command was used to combine data from the inpatient claims and outpatient claims table using the unique beneficiary ID, and data was filtered to only include those who have depression.